Namaskar. So today I have the privilege to have Dr. Vanshpriya Sharma with me, and with Dr. Vanshpriya, with her permission, I will drop the name Doctor and I will start calling her Vanshpriya. So with Vanshpriya, today we are going to start a series that is focused on Medicos and the struggles of Medicos. And why I am compelled to do this series because I have witnessed a huge number of medicos having struggle with mental health. So the whole process, in this process we will go through, because Vanshpriya has been academically a very bright student. She has done her MBBS. Now she is doing her PG from Ludhiana. And she has seen the struggle of these 7 years at least that she has gone through. So Vanshpriya, over to you. And I would like to start my conversation with one question. And the question is, how comfortable doctors are with the term called C for counseling or mental health?
I don't think so. Doctors are really comfortable with that, and also most of the doctors don't even believe that it's going to help. Because obviously we go very scientifically and think we have drugs, right? And we know all the mechanism of actions of all the drugs. So we know what to take and what not to take, which is very wrong because if you have a problem, you cannot, at least mental problems, you cannot treat yourself, and you obviously need someone else to at least a professional to give you an insight of what you're doing wrong, what you're doing right, and how things can go about it. I myself thought that during my MBBS years, I thought that I should also take some help whenever there was some stress or something. But I never sought the help. I always thought about it, but it should have been better if I actually took help from a
Thank you,
professional.
thank you, thank you, Dr. Vanshpriya, for being so candid. And I will request you to be more candid today, because your voice can reach so many of your people in your fraternity, some very green mind. What we always forget, that even if you're a doctor of heart, you need to go to another doctor if your kidney has a problem. Fine.
Yes, yes.
So what we always forget as a doctor, what do you think? What stops doctors from understanding that mental health is altogether a very different field, and they can have a mental health problem? Like, they can be having a problem with stress, they can be having a problem with relationships, they can be having a problem with insecurities, and why they all of a sudden jump to mood elevators, beta blockers, etc., etc., etc. In place of going for simple counseling, they study that it is, even in their course they study that it is going to help them. What stops them?
I'd say mostly it's the seniors. As soon as you start your MBBS journey, you are always told by your professors or anyone else, if maybe you have stress, they'll be like, "See, we went through it and we didn't cry about it." Or if we say that, like right now my working hours are very hectic, and when I said the same to my seniors, they said, even when we went through the same and we never complained. I was not complaining, I was just saying that it is, affecting me right now because I've moved to a new city. But that's how everyone always shuns you down, especially the older generation in this profession. And when you're shunned down again and again, you ultimately start thinking that maybe if I say something, they'll just say that I'm not strong enough or not competent enough to do the job. So we just shut down. That's what I've
Perfect.
seen with myself and my friends.
That's so such an eye-opening thing, because in mental health we always say one thing: it is okay not just being okay, but it is must to talk about it. And
Yes.
unfortunately, I think in the realm in the realm of being a doctor, this is something which is missing. I think doctors are not being, you know encouraged to talk about they being human, they having human problems. Because there's a rigorous thing, and believe me guys, when I tried to catch hold of Dr. Vanshpriya, I had to try to connect to her for 2 weeks, then finally I got to get hold of her, because she has been having that kind of schedule. Vanshpriya, can you take us through one of your weaker moments where you think now, when you look back at it and look back at it and see, you think if you had gone through counseling, that would have made a better difference, or that would have made you come out of it easier?
While I was preparing for my PG examinations last year, I think I should have gone to a counselor. I was under immense stress, and also I had shut myself from the outer world completely. I didn't go out of my room for some 40 days or something, and I was having a very unhealthy schedule for 40 days. So I think that whole period I can say that I sort of had PTSD after those 40 days and after the exam. So yeah, I think I should have definitely taken help from a counselor at that time.
Thank you. And uh, do you think that during the MBBS, you guys should interact regularly with a counselor? There should be a counselor service for especially people who are going to be responsible for others' health. Because
Yes,
when
yes.
you are not mentally absolutely in the best frame of mind, how can you diagnose best and how can you treat best? So don't you think it is something that you should suggest to your seniors, your administration, that for doctors especially, there should be counseling, mandatory counseling for doctors, would-be doctors?
Actually, my college had a designated counselor for the MBBS students, but the problem was that if you go to him, your other classmates will get to know that taboo is there, right?
The judgment.
Then your friends will ask you or something like that. So that's why I think even I never approached him. I never approached him in whole of my 5.5 years. I've never talked to him. He used to come twice a week, but I never talked to him. So I think
So
it's a taboo.
guys, thank you. So guys, as you see, we can always understand one thing. If Vanshpriya can just second me and put her opinion before we end this video, that medicines don't solve the issues that are created by attitude.
True that.
90% of stress problems, pressure problems, peer problems, relationship problems are attitude problems, and medicines can never be an answer to them. So can you please speak it in your words so that the MBBS fraternity, the doctor fraternity can get it loud and clear, that all the problems that you faced in those 7 years of your life, they were problems because of you needed an attitudinal change, not a chemical change in your head.
Definitely, if there's no chemical imbalance, then you cannot, those aren't actually symptoms. You cannot, medicines can treat you symptomatically, but if there's a whole, factory reset you need, then you need to go to a counselor completely. And also, I think medicos have a very unhealthy lifestyle. So that medicines cannot cure that, or even not only uh, bodily, it's also mentally. We have a very unhealthy lifestyle, right? We go through so much of stress, so we cannot just take